Okay, so this topic is for the laxative. So for people having constipation, they use laxative. Okay, the first case, a 40 years old man comes in for product for constipation. So what question you will ask? Okay. So the first, we still trying to just, so this slide is very important. From, it doesn't matter which course or side effect patch for adjustment. Okay, let me answer the question for Tahira. So the Tahira's question is any side effect when you use nicotine patches, okay, like fatigue, or I think the side effect, the reason why you want to quit smoking, yeah, because you know cigarettes got a lot of very bad thing, okay, and but when you use nicotine, they are different. So nicotine is something your body will get addicted to. So that's why we have to use nicotine product to help people to quit smoking. But in terms of the side effect, I think it's pretty, it, see, like pregnancy, pregnant women, they can't have, or any bad people that have the bad dream, or medication, people on certain medication, once they stop using it, they have to, the dosage need to increase. Besides that, there's no other severe side effect for nicotine. So that's why nicotine is pretty pretty, I wouldn't say safe, but it's not a big issue. Yeah, in terms of the side effect. Okay.
Okay, sir. Thank you.
Okay. So this so for this topic, laxative, we still have to find out who is the patient. Okay. So we can see there's a 40 years old man coming, right? 40 years old man. So we have to find out, are you the patient? Because some people that come in, they ask the product for their mom or for their kid. They are different. So you have to find out who is the patient and what's the symptoms. Okay. Constipation and any other symptom like fever or any blood in the stool. Okay. Have they tried anything? Yeah. You want to find out all, yeah, just like I said, you have to ask all the question. Okay. How long have the symptom been present? Okay. Taking any other medication, or they have other medical condition, or are they pregnant or breastfeeding? Yeah. So make sure you ask all the question. So this is like a practice, it's a habit. Okay, so after you ask the question, okay, you find out this patient just discharged from the hospital 2 days ago, because this gentleman's got car accident. It's a minor car accident, and he's taking tramadol 200 milligram BID for 3 days. Okay. 所以看到这里，你们有想到什么吗？为什么这个病人有这个便秘？这个病人为什么会便秘？有没有想过？耶，
可能是药物引起的这样
对
副作用。
药物引起的副作用，因为我们知道这个 tramadol 它的一个 side effect 就是 constipation。对，好 ，next one，OK， So the first slide is the basic question, but this slide is like focus on people having constipation. So like first one, taking any other medication, pregnant, breastfeeding, or recent surgery. So that means normally during surgery they probably have certain painkiller or general anesthetic that can sometimes keep causing some side effect for constipation, or any bleeding, or sometimes the symptoms are between sometimes occasionally constipation and sometimes can be diarrhea. How can this happen? Yeah, sometimes it can happen. And also, do they have any pain or taking any laxative before? Okay, or is for a child or for old people? Okay, so the first pregnancy, so most laxative, they are safe. They are all category A. But we have to avoid one laxative, which is we call senna. Senna is the stimulant, which means can cause can irritate or causing a constriction for your muscle. So we have to avoid any senna laxative in the first trimester. And for people they are pregnant, we tend to offer the bulk forming laxative. Yeah, we'll talk about what is bulk forming, and also the large dose senna Basicordia is can pass to the milk, so we don't recommend that when people they are breastfeeding. And people they have constipation during pregnancy sometimes can be because the hormone change or any because the bowel the baby is getting bigger and causing the pressure on the bowel, so sometimes can cause constipation. Or sometimes they take in the iron tablet. Iron tablet can during pregnancy is a very common vitamin or tablet the woman tend to have. So, but the iron tablet sometimes can cause constipation. Okay. So one of the question is like surgery. So after the surgery, sometimes they can cause the adhesion. 那个在手术后，有时候那个我们的肠胃会有 bowel might attach or stick together. Okay, so that's how that cause the constipation, or can be the effect for anesthetics. Or sometimes they after the surgery they take in some like opioid analgesic. Okay. So do they have to take the laxative often? Yeah, sometimes because there's lack of exercise, or they are sick. They stay in the bed most of the time, or they're not taking enough water or fluid, or they've been using laxative. You know, for people they are lady they want to lose weight. They tend to have some laxative, and some laxative, if they are taking too much, they can cause lazy bowel, or they have other disease, or the diet is with low fiber, not enough fiber. Okay, then we have to find out, is it for children or for elderly people? Because you know, for people they are the elderly people, when they have constipation, some stimulant laxative is not recommended. Yeah. So we tend to but in this case you know, bulk forming laxative is contraindicated for certain condition, like if the intestinal like bowel is already blocked, or they already constipate, the stool is very hard. So on top of that, if you didn't realize and you still recommend the bulk forming laxative, they can make more hard stool 就是如果病人他们的那个肠本来已经有一点阻塞的情况下，你这个时候使用这种所谓的 bulk forming 的话，那些 laxative 就是类似像那些什么纤维素类的这些它会形成这些好像胶质类的这些润滑胶质类，它会吸了很多这些水分，但是它有时候也是会造成很大的那个一些硬块，所以在它的排便如果本身已经有排便困难的情况下，这个时候我意思是说，它本身已经里面有肠阻塞，或者是已经有硬的粪便在它的肠里面，这个时候你如果再给它这些 bulk forming 的这些 laxative 的话，会更加重这个问题。那另外的话，如果是小孩子的这个便秘，有时候是因为他们的那个长期下来，他们的那个便秘已经造成他们的那个肠道已经撑开了所以肠道一旦被撑开，那它可能要3个月到6个月，它才会恢复正常所以在这种情况下，我们要推荐的那个泻剂可能也会不一样。这个等一下我们会再提多一点好，我们接下来 ，so the next we're going to there's a certain category for the laxative. The first one is bulk laxative, or the stool softener, or osmotic, stimulant, lubricant, and suppository. The first one is bulk laxative. 刚刚我们提过了这些所谓的 bulk laxative， 就是里面有含很多的这些所谓的纤维素它会 absorb the liquid into the intestine and form a bulky liquid like stool. OK， 所以说它这个 bulk laxative 它会吸取很多的水分。如果你把这个 bulk laxative 放到 put it in the water, what would happen? It will form something like jelly. 所以如果你把这种 bulk laxative 放到水里面，通常过了5分钟左右，它会形成像那种好像果冻这样子的一种液体。我所谓果冻的话，就是大概它就会软软的但是这种果冻的它就会让你的肠道呢，你的大便里面会有很多的这些水分这样子的话就比较不会去造成便秘。但是如果我刚刚有说到有一种情况，就是这个病人已经便秘了 ，so if this patient is already constipated and have very hard stool in the bowel, then in this case, if you put more bulk laxative, it's too late. It's too 就是在这种病人的情况下，如果你就是说这个病人已经有那个非常硬的大便，如果你这个时候还是说你去吃这个纤维素，第一个太慢，第二个他所吃进的任何的这些东西呢，它都会被塞住，所以它不但不能解决问题，它还是会让这个问题更加的加重那通常这个 product 有这个，我不知道台湾的市面上有没有这些Metamucil， 这叫 Metamucil， 另外是 Normaco 或是 Plus
老师，台湾有 Normaco，
这应该在药局里面一般的，但是这是在一般的药局里面，还是说在医院的药局才有？这是处方签药吗？
是
在医院
不是处方
有
签要？我不确
医院有，我记得
只知道在医院有。对，
20年前、二十几年前有在医院，我在医院的时候，医院都是有在用这个东西啊，但是这个东西是在澳洲是就是成药，都是 over the counter。
美塔莫斯也是那个叫做居前酯啊，或者叫车前
对，
酯。
车前酯，对，Cilium，英文叫 Cilium，我们叫做
怡颖这台湾有吗？
那个 M 开头的吗？这个，
对，
是
它的成分就是上面它写的这个吗？就是
Cilium 它的我这里没有写 Cilium PSYL
哦，
LI 什么
我好像
IUM
没有看到相关的
就
产品。
就是车前子，一般是说
对
车前子的纤维
我好像没看过。
嗯，
对，好像只有看到下面这个。
都
不会你们
是那个 high fiber 的高纤的。
它是叫做英文的话，我们叫它 Metamucil， 对吧？它这里叫 Metamucil， 对。所以记得，如果这个病人本来就现在已经有硬大便塞住了，这个时候或者是他的肠道有一点阻塞，我们就这种 bulk laxative 我们就先不要使用，因为它吃下去只是让他的那些大便更塞的，已经塞车了，你再给他这些东西是更塞啊。那这个时候我们就要用，不能用这个的话，我们就要用什么其他的？对。好，第二个叫做 stool softener， 这个叫软便剂哈，软便剂也是用在轻症啊。那这个情况如果也是一样，如果病人已经有便秘的情况下，吃这些 stool softener 是无法改善，就是要改善的话是缓不济急。Yeah, if the patient is already constipated, then stool softener is a bit if you recommend stool softener, yeah, it's okay, but it's too late. It's too late. For stool softener or any bulk laxative, you have to use as a preventative. You use in advance. Yeah. When the people have constipation, we're not going to recommend softener or bulk laxative. Yeah. So stool softener, it works by increasing the amount of water absorbed in the gut and make the stool softer and easier to pass. And or for certain people, we have to avoid the straining or to have a bowel movement, especially when people after the surgery or after the heart attack or even the elderly. 所以什么时候我们会比较推荐软便剂呢？就是特别是这个他们最近可能有肠道的这个手术啊，这个时候你不希望他的可能因为我们知道我们在排便的时候我们会很用力嘛，对。那这个时候如果你可以加一点这个软便剂，让他的大便软一点，或者是说老人家他们这个时候可能你给最安全的这个也是就是给他这种软便剂啊，或者是刚刚我说那个 bulk softener bulk laxative， 这些对老年人来说，这些都是相对这个药you know the docusate， 这个 the ingredient here docusate， this is a very safe medication。But only when you use for very mild constipation, yeah, it's okay. For pregnancy, okay. But it's not going to work or help your constipation straight away. It takes a while to work. Or normally we use as a prevention. Yeah. Okay. And this one, osmotic laxative. So osmotic laxative, this one will include the flow of water into the intestine. 所以这个 osmotic 就是借由这个改变渗透压然后它会把很多大量的水分会把它留在你的肠道里面。我所谓大量是 像刚刚我们说的 bulk laxative 或者是 softener， 它是借由它的成分的本身去吸住这个水分，可是这个 osmotic 它是借由渗透压，所以它会留在肠道的水分就会相对的比所谓的less 这些我们刚刚提到这些 softener 或者是 bulk laxative 会来得多，所以效果会稍微效果会更为显著啊。但是你知道越显著的效果越好的药，也代表说可能它的效用会稍微强一点，对于一些老人家或者说一些长期的使用，有时候就不太建议会长期的使用。Okay, the most famous osmotic laxative is lactulose. So lactulose is a kind of sugar. The structure is like sugar, but it's the sugar your body or your bowel the bowel won't absorb. 所以这个最有名的是这个 lactulose， 它是一种类似像糖的结构，蔗糖的结构，但不是蔗糖啊。你知道我们吃糖或者是什么，不管是果糖或者是什么糖上面有很多的那些什么 OHG 有没有？这些肌都会吸水分。那这个糖它刚好是我们人体不吸收的一种糖，所以呢，它会造成很多的水分就会被吸引到我们的肠道，然后造成这个缓泻的作用。Okay. One of the osmotic laxative is we call saline laxative. So saline laxative is a bit stronger. 它就是类似像这个东西叫做泻盐，所以泻盐就是里面有含有，例如说镁离子的泻剂就是属于一种泻盐。那它这里面就含有很多的这些盐类很多的这些，所以我们叫它 saline laxative。那一般我们在做那个什么大肠镜要清那个肠道，我们就要使用这个 saline laxative， 因为它会吸很多的这个水分，然后甚至把你的肠道有时候是因为有水分的关系，它里面有太多的水分，那借由这种泻盐，它可以把它清得很干净但是效果有时候也太好了好到有时候对人体会有一些比较长期使用，你如果偶一为之 OK， 但是所以像你说只是做一个大肠镜，我们使用这些saline laxative, if you doing the colonoscopy, you do it once or twice a year, it's okay, but it's not recommended you use this saline laxative like weekly or even monthly. Yeah, this one's very strong laxative. 所以当你吃了这些，你接下来那个大概过了6个小时后，你的肠胃就会感觉是一堆的水，因为它通常在吃这些laxative 的时候，它会要你尽量喝水，而且通常这些盐类的 ，so when you use those saline laxative, you normally put one sachet into 250 or sometimes can be 500 ml of water. So when you drink that 500 water or even 1 liter water in 1 hour, what will happen? After drinking those water in 6 hours, you will go to the loo and your bowel just like crashing， 就是好像冲马桶这样。吃了这个泻药，你的肠道就像在冲马桶，冲得一干二净这样。那这样子才能够你的肠道才能够清得干净，而且可以做那个大肠镜的检查。Okay. So for the side effect, can cause abdominal cramp, or 而且它can cause the intravascular volume depletion， 因为它的那个泻药的效果是非常好，所以有时候甚至会拉到脱水所以说为什么我们不太建议它长期使用。而且在泻下的过程中，有时候你会造成电解质 electrolyte imbalance disturbance 那 contraindication is renal deficiency， 如果你的肾功能不好这个也会造成影响。 啊，所以这个部分你们可以自己看一下。OK， 接下来是 stimulant laxative， 就是我刚刚说过里面的 bisacodyl 或者是有 senoside， 这个有senoside 就是中文叫做什么番泻，它是番泻叶的这个里面有番泻叶的成分，它都会刺激我们的这个肠道，会造成你的肠道的肌肉收缩，来引起这个排便的感觉啊，所以呢，通常我们也是 not suitable for long-term use because if you keep stimulate your bowel, then your bowel will become lazy. So that's why we call lazy bowel. Okay, so just 所以要记住这个刺激性的这个 laxative， 它会造成 lazy bowel， 就是你的肠道会变得越刺激，以后它会怎么会越满回啊那个啊。那什么情况我们会使用 stimulant 就是这种 stimulant 的 laxative 呢？就是我们刚刚的那个情况，我们刚刚那个病人是不是吃了那个I think the case one, the patient is on tramadol and causing constipation. So you know those opiate or any those medication that can cause constipation is because they slow down the bowel motion. So that's why you have to, when you treat the patient like they're taking opiate drug, you need to add stimulant. Yeah. Because when you use other laxative, it's not going to work better. So stimulant, when people they 如果病人他们有吃这些所谓的止痛这些吗啡类的这些止痛的药的话，所引起的这个便秘，我们就会推荐 stimulant 的这个止泻剂。OK， lubricant lubricant， 所以你看到这张图画 ，you see a baby, right？ 所以表示什么？这个东西是很适合在小孩子的便秘，治疗小孩子的便秘。So as I mentioned, when kid had constipation, is the reason behind is normally their bowel is because it's a long-term habit. So their bowels already been enlarged, bigger than normal. So to get their bowel size to get back to normal, it takes about 3 months to 6 months. So you have to use something like for long term. They have to take it every day. So the safest one for the kid is this one. It's called mineral oil. So the main ingredient is liquid paraffin. 所以这个成分是属于那所谓的就是液态的这种石蜡。那这种石蜡通常呢，is not absorbed. This liquid paraffin is not absorbed in the gut. So it works as a lubricant. 所以因为它在这种石蜡，它在肠胃道我们是无法吸收的，所以它在肠胃道就会变成是一种润滑剂。所以小孩子如果当小孩子有便秘，通常都是长期的，所以你通常给他吃一次那些什么止泻剂啦，他的问题会不断的回来，所以你必须要给他这种所谓的长期的使用这样的这个药物那而且必须跟他说是要使用3到6个月，因为肠道要恢复正常需要3到6个月的时间所以你一定要 you have to advise the parent just keep using this product with liquid paraffin, the product called Parachoc because chocolate flavor. So keep using it for about 3 months to 6 months, then it will work. Okay, and the suppository. Okay, suppository is something you will work straight away. So normally the ingredient is glycerin or bisacodyl. You know, bisacodyl is a stimulant. And Mycolex is a lubricant too. So you just put the suppository into the bottom, and normally it will work straight away in half an hour. You can tell the patient, okay, after you put a suppository in half an hour, you'll feel it, and you'll go to the toilet. And if one dose like this one, the Mycolex, because Mycolex, the ingredient is just lubricant. So if one lubricant is not helping, you can tell them to use 2 or even 3. Yeah. But not for the stimulant. Stimulant, you wouldn't recommend like using 2 or 3. You just use 1. Okay. Okay, the case 2. 20 years old lady coming with constipation and has been pregnant for 3 months. What question you will ask? 28岁有一个孕妇来了，你们会 What question? Yes. The first, Tahira, what question you will ask?
Sir, any previous history regarding any other medication taking, and from how long, and what are the symptoms?
Yep.
And
Yep.
yes, sir.
好，所以 Tahira 问了说这个symptom 有多久了，还有这个吃过什么药？好，我们请千羽。
我会想要知道，假如他的这个便秘的状况是长期的话，会不会其实这个人本身的生活习惯、饮食方面，就是蔬菜水果或是喝的水分，就是他从健康生活下手，或许可能本来就有一些状况，或许可以先从这边开始解决。
也可以，所以你觉得你会问些什么问题？
我会问他，就是平常你吃蔬菜水果的频率，或是一天喝水大概都喝多少？
嗯哼 ，OK， 这个也可以。那怡莹呢？
我可能会问他有没有药物过敏史。
嗯，药物过敏 ，OK， 所以你会想说他，我们推荐的药有一些他会过敏，这个也是可能发生的。OK， 好，我们来看一下这个这个。So this lady has been pregnant for 3 months. So which means when the baby is getting bigger and bigger, yeah, this is some issue. Okay. And just like your question, maybe the diet for this lady is not good enough. Yeah. No, not much food or veggie. Yeah. Okay, so in this case, the case 2, what would you recommend? What would you recommend for this condition?
Sir, more fluid intake,
Yeah,
nutrients, electrolytes, and fiber
对
diet.
The first we can recommend, yeah, the diet, yeah,
Yes, sir.
or
Proper
increase
diet.
the food intake. OK， 那怡颖呢？你会建议什么？如果说他试过的这些还是没有效，你刚刚问过了，说have you tried anything? Yeah, I tried the food and diets, but it's not helping. What would be the next step?
Then, sir, medication.
Medication, yeah.
Yeah.
So what sort of laxative you have to avoid first? You know, as I mentioned in today.
bulk laxative，
Bulk laxative is okay. Yeah, we have to avoid the stimulant. You know, for the first trimester. 还记得吗？ Remember?
有
对，因为可能
嗯
会造成流产，因为那个 stimulant can cause the bowel like cramping or constrict. So it's not recommend for first trimester. Yeah. Okay. So sometimes we can so from the list we probably can all recommend. You see, but would you recommend osmotic, especially the saline one? Saline laxative.
Bisacodyl, sir. We cannot recommend the bisacodyl, right?
We can. What did you say?
Sir, we cannot recommend bisacodyl.
Yeah, we wouldn't recommend the saline
Yes,
because,
sir.
as I say, saline is very we use we not recommend for a lot of case, only for one off. 对千羽呢，
Yes,
你会建议什么？
可能会建议前面说的那个 store softener，就是软便剂，因为对，因为其他感觉都有点，因为这病人是怀孕状态，所以他应该是这个软便剂会比较好。
那如果今天我那些方法，刚刚你们说的那些我都试过了，但是我已经便秘了3天4天了，这个时候怎么办？我已经便秘了。I already the patient is already constipated and pregnant and constipated for 4 days, 5 days. What would you recommend? Can we use suppository? Okay.
如果是要快速暂时先缓解他现在的那个 support，
我们先let's finish this section. We